so we've got another speaker for you now who probably paint a different perspective for you. His name's Dr. Mark Lawrie, and he, like Felicity, has a wealth of experience. I'm actually going to go through some of his for you so you get a sense of who you're listening to. He's currently General Manager of Asia Pacific for RxWorks, which is a company providing practice management software for veterinarians, which is, you probably hear that and you go, well, why don't we need to hear from a software manager? Which is what some people have said to me. But when you hear the rest of his other credentials, then you'll realise how much he's going to bring to the discussion today. He was the director of the Murdoch University Veterinary Hospital for 3 years until September 2014. He was the national president for the Australian Veterinary Association for 2 years, the chief veterinary for RSPCA in New South Wales, overseeing 4 hospitals, and for 15 years the Secretary of Animal Management in rural and remote Indigenous communities. He was a member of Animal Research Review Panel in New South Wales for 10 years and has been a member of 3 large institutional animal ethics committees and has conducted formal reviews of alleged breaches of Animal Research Act at major universities. He is currently a member of the National Health and Medical Research Council Animal Welfare Committee. He performed a major review of Blacktown Animal Holding Facility in 2010. He's presented on various animal welfare topics, including the regulation of animals in research and teaching, veterinary forensics, and the link between violence to animals and people, unwanted companion pets, animal hoarders, and live animal exports. He has worked or presented in a veterinary capacity in 19 countries. So you can see you have someone with eminent experience speaking to you today. And I have to say, a few people, when they heard we were having him come and present, said to me, wow, you're lucky. He's the best person to speak to. So we hope we've got you the very best here in Dr. Mark Lawrie. Thanks.
Thanks, Sam. Yeah.
Oh, you're playing it safe?
Yeah, I'm playing it safe. I got the message.
Are you okay with the IT?
Yeah, should be right. I'll see how we go. Yeah, thanks everyone. I was actually the chief vet with RSPCA for 15 years rather than with AMRIC for that long. And I once at a conference spoke about, on this very issue about unwanted companion animals, that, you've probably seen those statistics, you may or may not, that if one male and one female cat over a period of 8 years, if they have this many litters, they'll multiply to like 90,000 cats over that period of time. And dogs will get to something like 16,000 or something like that. And I figured out from all the dissexings that I did at RSPCA over the years, and this was about 2007, 2008, that I was responsible for there being 90 billion less cats in this country and something like about 90 million less dogs. So I am a vet, although my son was sort of asked at school, my 11-year-old son, one of the teachers said, your dad's a vet, isn't he? And he said, he used to be, but he's not anymore. But fortunately, I was up in PNG just 2 weeks ago and I managed to do a surgery for the first time in 2 or 3 years. So I feel like I'm a real vet once again. I do have a lot of knowledge in this area and I have researched this area a lot because of my involvement at the RSPCA. Certainly emotionally, I was very attached to it. I started working there in the late 80s, and I remember one day where there was like 270 cats euthanized on the one day. And, if that doesn't affect you, then nothing will. And over the years, I rationalised the work that we did. I saw many improvements, and I think there has been a lot of improvements. And I do want to talk about those because I think that from those improvements, you can learn, well, what has made an impact and what's made an effect. I think it's critical, as been mentioned, the evidence base is what you need to go back to. As a scientist, I know that if you don't use an evidence-based approach, you're going to come to conclusions and solutions that aren't necessarily going to work in an effective way. And so I really want to emphasise that. And I've handed out a couple of papers there. One, a summary paper that I presented at the Australian Institute of Animal Management a couple of years ago, slightly dated. And then there's also one from ASPCA in America, specifically on mandatory spay-neuter, which is the way they say dissexing over there. And I'll be transparent and open. I don't think mandatory spay-neuter laws or dissexing laws actually work from the evidence of where they've actually been put in place. And I'm totally for dissexing. And the more animals that get dissexed, the less animals there will be. But I think also that we're gradually getting to that point with the strategies that we're doing, that we are making improvements. And there's different things in different states, and some things in some states aren't as good as others. And the statistics issue is one thing that really needs to be focused on, I think, in this state, so that you are getting accurate statistics, so that then you can put in fixes and then measure those fixes. Classic management issue is if you don't measure it, you can't manage it. And I think that applies to this particular issue as well. So I just want to underpin those. Limited amount of time to go through things. I also work for the International Fund for Animal Welfare, looking at developing a program in South Pacific Islands to try and control dog and cat numbers there. And that's when I first started to get more engaged into the scientific side of how to deal with this problem. And that was back in about 2003, 2004. And from that time on, this has been a constant issue that I've looked at, revised. Obviously, I'm working for a software company now, and I'm still interested in this topic because I want to see the numbers decline. I want to see less euthanasias because of my involvement with it over the years. So I'll try and just quickly go through things, and I don't want to just talk about mandatory spay and neuter, because let's look at some of the other strategies and things that we need to be considering to bring the numbers down, and that you could maybe have as part of your recommendations back to the board and to the minister. This is just a quick picture of a fat cat. His name was Mickey, and he was at the RSPCA. I think he weighed 9.7 kilograms, something like that. And Mickey we got his weight down. Like fat cats, there's some real dangers, just like there is with humans, with being too fat for too long. And Mickey came in, he doesn't look very happy. That's because we took his food away, we reduced it anyway. And you shouldn't take the food straight away from a cat. But Mickey, it took us about 3 or 4 months to get Mickey down to about 5.5, 6 kilos off the 9. And I always use Mickey as an example that you have to have patience. And, you know, I had to have patience when I worked at the RSPCA all those years to see improvements in some of the things that we did and getting programs started and stuff like that. And Mickey's always my reminder that you just got to take things gradually, but things can get better. We'll look at that. So unwanted companion animals, or pet overpopulation, is the euthanasia of dogs and cats in pounds and shelters. And the question mark is on the streets or in the forests. And we'll look at that, and it's already been sort of touched on. I think you have to divorce yourself a little bit from what you're considering, as was mentioned by the Minister and by the Chair of the Board, from the feral population. Because as we'll sort of see, there's sort of subpopulations of unwanted companion animals, and you have to influence them in different ways. It is an emotional issue, but there are some reasons for joy, and obviously we need to find out what things are working and do more of those. The solution is simple, but it's not easy. Hard work over a long time with patience, wisdom, common sense, and recurrent funding, and that's always a big problem. And this is probably the quickest way we could fix the problem, is because where the source of the problem is not the dogs and the cats, but it's their owners, as we know. There's just a concept of zero population growth, which is a bit of a fluid thing, but basically it's thought to be around about sort of 88% for cats, and maybe around about 70%, 74, 75%, varies. And if you get that many female dogs within a population, or female cats in a population spay-neutered, then you won't get a growth of the population. And in Australia, some of the surveys of cats in owned cats is that we have spay-neuter rates of 95%. Most of them are over 90%. Well, why are we still getting unwanted cats? Well, the question will be, well, it's because many of them are not owned, and they're contributing to the population that's coming into pounds and shelters. We'll consider that a little bit more. And there's just this concept of cat population. So we've got the owned cats, who are probably not contributing to the problem, the well-owned cats, and then you've got the stray cats or semi-owned. They talk a lot about semi-owned cats. And these are sometimes ones that are actually wandering into people's backyards and saying hello every now and again, and they feed them, but they don't do anything to control them. They don't get them to sex, and of course what happens, and the more you feed them, the more litters they have. And a lot of research work that's been done in Victoria has really targeted that focal group, or that area, as being contributing to the numbers of animals that are coming into pounds and shelters. And there's a recent research project in Queensland, similarly, that's identified that as a very important area to focus on. So what I want to get across to you is the concept of doing something is about targeting your effort and not wholesale fixes, silver bullets or broad strategies necessarily. It's really trying to target the areas and the problem areas. And then of course we've got the feral population. Can I just get a bit of water? The feral population on the end, and as I mentioned, they're probably not coming into the pounds and shelters as much. They will a little bit, but they're not the big numbers from some of the research that we have, but still something to think about and worry about. Back in the late 90s, when I was first starting to get really involved with this, there was a number of different people that were really focused on it. Tim Adams from Pius was a vet who was really interested. Carol Webb from Cats Protection League in Victoria. We had representatives from all different groups, and we got a task force together to say, well, you know, what is the reasons why there is this problem and how can we fix it? And we came down with 5 strategies: understand root causes of the problem, education in responsible ownership, identification, microchipping is a classic one, targeted programs, and again that targeted word is something to remember, balancing supply to demand. And from that time on, certainly the work that I did at RSPCA, we tried to focus into those areas, and I would encourage you to look at the work in that space, and it's in one of the papers there, and expand it out a little bit, as being the areas of focus that do really bring some benefit to this issue. Whoops. Again, going back to the root cause of the problem. You know, if the boot was on the other foot and we were dissecting the humans, the dogs would probably be more responsible owning us. The 2 things that we must do, obviously, and this is simple for anyone with thinking, but just worth thinking about, reduce the numbers coming into shelters or in the streets by reducing breeding, reducing relinquishment and reducing straying, and then increase the rehoming rates by having new programs if they are effective and work, and we should test them and see what effect they're having. Marketing programs. We need to be careful about that and not sort of talk about the doom and gloom, the euthanasias too much, because there's actually been research to show that some people avoid going to pounds and shelters because they don't like the concept of them as being dark places where animals get euthanized, and it's a discouragement for them to visit and actually reclaim an animal from there. And so there's been a real change in the way the shelters are presented, and they're made to look a lot more airy and light and better marketability, and you know, that's a good thing, and we need to support the shelters and the pounds as well that work in that space, and that's the reason why they do it. Encourage taming. This is of semi-owned cats and encouragement of ownership. A really good program in Victoria called Who's for Cats, if you get a chance to have a look at that, which is encouraging people not just to feed a cat that comes in their backyard, but to take on the responsibility of ownership, or even if it's a matter of getting the cat and taking it to a pound and shelter so that they can maybe rehome it, or even if they euthanize it, it stops it contributing to the pet overpopulation supply. Who's for Cats is the name of that. A very good program that's been analysed and does work. Other interesting factors is that because of modern veterinary medicine, we've actually seen a rise in the life expectancy of pets, dogs and cats, and because of confinement, less animals getting hit by cars, they're living a lot longer. And that's probably slowed down some of the progress we've made in reducing the numbers of pet animals dying in pounds and shelters in the unwanted companion animal. But it's probably reached a plateau now. Where I'm saying that from there is that we actually didn't have as many new opportunities for owners to get animals, because the dogs and cats that they've had over the last probably 2 decades have lived a lot longer. And while that period of time was happening, that meant there was probably 5-10 years where there was a slowing of the takeout of animals from pounds and shelters, and that's probably played a role in slowing things down a little bit, but I think we're over that now. When I was in PNG, the first time I worked up there at the RSPCA, which is the only vet clinic in the company, and I was driving around with the vice president. I said, I can see a lot of stray dogs on the streets, but there's not many cats. And he said, it's a bit embarrassing really, but the dogs eat the cats, and that's why there's no cats. And one of the issues that we see with this problem is that when we control the dog numbers, often then the cat numbers grow. And we see that on Aboriginal communities. And the work that I do with AMREC is that once we get the dogs in check, the cats start to multiply, and then you've got to work on that. So it's just another principle. Small groups with good governance have really played a very positive role in the last few years. Rescue groups and rehoming groups and online rehoming have really contributed, sometimes with the mainstream organisations, sometimes with pounds and shelters, and they're really to be thanked and have played a very important role in improving things. But there are some small groups with poor governance, and that's one thing you've got to watch. There is this issue of animal hoarding. Who's heard of animal hoarding? Yeah, it's a really big problem, and it does contribute to the numbers of animals that are euthanased in pounds and shelters. Probably every year at the RSPCA, we would have euthanased at least 500 animals a year that had come in from a hoarder's environment. Very difficult to rehome. We've rehomed probably another 500 as well, but often they have really severe disease and behavioural problems. And hoarding is still a reality now. I'm not sure how prevalent it is in this state. Nobody seems to know because it's behind closed doors. But it's something that needs to be worked on as well in reducing the numbers of euthanasias. And also the behavioural and disease management, the risk of recycling. If things aren't being run properly by rescue groups or even by the RSPCA or Animal Welfare League or pounds themselves, we need to make sure we get it right and make sure we get positive and permanent rehomings. Like the way we deal with the animals. Here's a case of a hoarders that we dealt with back in the noughties. Out of that task force, just to enlarge a little bit more, the 5 strategic principles that we came up with, and we call it the ADA task force because it just took ownership of the information, was to understand root causes, including the need for accurate data, and I just really emphasise that. And I think one thing I've just found out already, just in coming to South Australia, or sort of knew about, was that there's not good wholesale statistics here. And that's one thing that New South Wales and Victoria now have, and I would encourage a recommendation to the Minister to take steps and investigate ways to legislate, and that's what happened in New South Wales, for councils to supply annual returns so that you've got a good fix on the numbers of animals that are being euthanased across the state. And then when you do things, you can actually see what impact that might have. If you don't measure it, you can't manage it. Education and responsible companion ownership, that's pretty much, and they've done some really good things in South Australia, particularly around the dog bite issue. And so that behavioural thing, so you've got some brownie points in that space in this state and done some really good things. Identification, obviously, microchipping, but they're even mandated. Microchipping is not 100%, and this is part of the problem in saying mandated, we'll mandate this, we'll mandate that. There are many people that don't obey laws, and there are many animals that aren't owned, and they're not impacted by mandated laws for identification or desexing, and that's just one thing to think about. If you pass a law, you need to be able to enforce that law, at least in a reasonable way, to try and make it effective, if that's going to be an effective solution. Strategically target programs like subsidised spay-neuter programs, and there's some particular risk communities that you need to focus on that. Perhaps we'll touch on that a little bit later. Balanced population supply to demand. As we saw the numbers of puppies particularly dwindling in Sydney, we started bringing them down from our shelters in RSPCA, from Orange, Dubbo, Bathurst, places like that, into Sydney, where from an area of oversupply where we still hadn't really impacted as strongly as what we wanted to an area where we weren't seeing as many puppies and kittens. They had become a scarcity, and so that was one way of dealing with that issue. And that's something to be considered. You've got to look at the sorts of dogs you're getting and how well behaved they are. You know, there's risks that if they're born into a poorly managed environment, then their behaviour will be such that they'll be difficult to rehome and to rehome sustainably. You need to take into account all of those things. Understand the root causes. Read lots, and you guys are going to be doing a lot of reading by the sound of it over these next few weeks. Read carefully and discuss things. Try and take an evidence-based approach, a science-based approach, where you're actually critically analysing the information that's put before you and seeing if proper research work has been done and whether it's been successful. And, you know, research comes and goes, and sometimes subsequent research can show that the previous research wasn't actually correct and right. And that's been the case with some of the TNR programs that were originally really pushed very strongly from the US, but have been sort of shown not to be as effective, apart from enclosed environments like islands or university campuses. There is some good stuff around. What is really needed, and I would encourage as well, it's probably not part of your brief, but more money into research would really help focus on this issue, doing proper research, through the universities, through animal science and vet science areas at the unis, and we've got some great research capability in this country, but we don't have very much money at all for dog and cat research across the spectrum. And so that's an area to look at. There's been some good stuff done. Megan Pendergrast did some work at Sydney when she was still a student with Robert Dixon about relinquishment of dogs in New South Wales, rural pounds. Corinne Hanlon, and now Sarah Zito. She's presenting at a conference in a couple of weeks about relinquishment of cats at RSPCA shelters in Queensland, and again focusing on the problem of the semi-owned animals as part of that. And then at Monash University, Marston et al. Has done a lot of work there. So it's really important to look at that research, and that there needs to be more research. Education in responsible pet ownership, formal programs through schools, birth centres, as was mentioned before. Good work being done in South Australia, particularly in the area of bite prevention. Appropriate selection of animals is really important, educating people. And there's been a lot of ground made in that area through the veterinary profession and elsewhere, RSPCA and Animal Welfare League as well, in trying to make sure there's sustainable rehoming. Proper training and socialisation is just so important, and something that we do know a lot more about and we need to encourage. And if we can sort of get that in our messages, if it's in there as part of legislation, difficult to legislate on again. Behaviour screening at shelters is also something that's happened, and rehabilitation programs there, and more of those are happening, particularly as the numbers decline. Identification, microchipping, just scan through that pretty quickly. And then I've got in there the issue of enforcement laws, which we've already spoken about. Also really important in Australia is social marketing. We're a country that is actually, despite our convict streak, very responsive to good programs. Seatbelt wearing, we're one of the first in the world. Cigarette smoking reduction, slip, stop, slap, and spay neuters, desexing. We're actually a lot higher than the US in the percentage rate of voluntary spay neuter in this country. And so we can use marketing programs, social marketing programs to educate people and get them to do that. Targeted programs. We set up some programs in New South Wales called CAWS, the Community Animal Welfare Scheme programs, and they were a combination of spay and neuter. What we did, we found that it was in the country towns we had the highest euthanasia rates, particularly the Riverina and the Western District. So we collaborated. I got some funding from Jan Cameron, the former owner of Kathmandu, when she had a lot of money and was willing to put it into good projects. And she's very focused on animal welfare programs. And we would go to a country town for 2 weeks. We would send a vet and a nurse to work at a local vet clinic there who were under-resourced to be able to do high levels of spay and neuters. And we would do media programs and education programs at the same time. And we found those very effective, and I've got some data on that in here. One of the quotes from the US by one of the guys that has done a lot of really good research there, Peter Marsh, his name is unwanted, untargeted programs waste 75% of funds. If you do a subsidised spay and neuter and the person that owns a Mercedes goes and utilises that, it means there's going to be less money down the bottom end for others to do it. And so you really do need to means test to be clever in the way you set up your targeted spay and neuter programs. TNR, sort of mentioned that briefly. I'll just go through things, I'm conscious of time. Short-term projects are a waste of time. We found on the Indigenous communities, if you go do a program and you don't go back for 2 years, the animals are just going to multiply back to the numbers they were beforehand. You really need to be looking at every 6 to 12 months minimum, to go and do a program. Otherwise, the numbers just multiply and get on top of themselves. Mandatory desexing. I've sort of already made my sort of points on that. It's the evidence that we've got from the ACT in Australia when it was implemented there in the 90s was it didn't actually have a positive impact. It didn't reduce more. The numbers fell more slowly in the ACT than they did in New South Wales and Victoria in that period of time where they put in mandated spay and neuter for cats. And a lot of the evidence from the US, which is in that article, and sort of related places, actually led to higher levels of euthanasias, probably from more surrendering, particularly of the poorer people, which touches on that issue about affordability and impacts that it might have. And that's the risk if you put in strong legislation like that. What is the risk assessment impact, and is that going to be done, and what will be the outcomes of it? Some of the evidence around the world suggests that it's a bit risky to do that. Have a read of those articles. So I've just sort of mentioned that there. And this is one. I love this. Is my favourite Far Side comment. Ha ha ha, Biff. Guess what? After we go to the drugstore and the post office, I'm going to the vets and getting tutored. Little does he know. Balancing the population to demand. We've already talked about that. Early age desexing is really important, and don't get me wrong, I'm pro desexing. And wherever you got hold of the animals, and the great thing about the RSPCA and the Animal Welfare League and the pounds is that if you have control of the animal, you can make sure it's desexed there. You don't have to worry about having a law to do that. And we implemented early age desexing at the RSPCA in the mid-90s, and basically it's right across all of the organisations. It wasn't at Blacktown when I did the review there, recommended it, and it's been implemented there. If you've got pounds and shelters that are releasing animals undersexed, then stop it in this state. Make sure that when they're rehomed that they're spay-neutered, whether they're desexed, and that contributes to the reduction that we've seen over the last decade or so. Puppy farms, I think sometimes they're a little bit overrated, but obviously need to be controlled and are potential contributors. Pet shops, I think pet shops, the heat's gone out of that debate because pet shops are doing a lot of rehoming for pounds and shelters, well not so much pounds and shelters, but RSPCAs, particularly in New South Wales and Victoria. And that's a good thing, if the pet shops are part of the solution rather than the problem, well then, that's a good thing. Chemical sterilisation, we keep having these dreams it's going to happen, and just God made animals to breed, and humans too, and it doesn't seem like there's easy ways to stop them. And so surgical spay neutering, surgical desexing is still the way to go. That was a picture from Kelso, and that's a picture from Coonamble, where we went in collaboration with the local vets there. And when the funding, Jan Cameron is a bit fickle, and she took the funding away after we'd done 2 years of the program when we wanted to sort of expand it further. And this vet clinic, Scott Parry in Coonamble, actually did their own program and funded their own program with some help from the council up there. And it's interesting the actual impact that such programs can have. The Kelso program, Kelso is a housing commission area outside of Bathurst, where a lot of the Indigenous people who have relatives in the jail go and stay and live medium to short term or longer term. And it had a real problem, with straying dogs. And in a 6-month period prior to a program we did, there was 124, I think it was 62, so 124 per annum, dogs were impounded into the Bathurst Pound, which was also run by the RSPCA or in collaboration with the RSPCA. We did a program, and we did 126 dogs and cats on one day in a vet clinic, and I don't think it's the best way to go. It's better to stretch it out over 2 weeks. But the impact of that program, which was focused on Kelso, meant that in the next 6 months there was 18 dogs impounded after that, and then after that 15, then 29. So it had a huge impact. And Deloitte's actually came and did an analysis of the work that had been done in Bathurst, and they basically came up, and I just haven't got a link to it at the moment, but I can probably dig it up for you. And they came up, the cost of the council $10,000, and the analysis that they did, it saved the council $12,000 and some hundreds of dollars in the savings that they made through impounding, euthanasia, disposal of bodies, and all those sorts of things. So I just really want to push the concept of targeted programs, and if you've got money to pass new legislation, direct it into doing things like that, because there is a cost of legislation and enforcement. This was a really good picture. Is your pet a sex offender? And this was the SPCA in New Zealand did this in Auckland, and they stuck these signs up around on the telegraph poles, and they had another one. There's a sex offender in your neighbourhood was part of their program. They got protests and stuff, and they had to take some of them down because it was a bit upsetting for some people. But they worked really well in getting the message across with that one. So, the power of the press and media and marketing is also important. This was Gary Patronak, and it's just interesting because we were talking there before about, who's going to have a moggy and all that sort of stuff. And I don't think with cats this is as big an issue as what it is with dogs, but Gary Patronak, can everyone read those? Does anyone want me to read them out? Or you got them? Yeah. It's just interesting, the things that we do and the changes that are happening. We did some work up in Taree on an Aboriginal community, Purfleet, which is really got some great pictures, and some really good work was done there, with the people there. In the last 10 years, there's been a decline in unwanted companion animals, and I'll show you some data. high sterilisation rates of owned animals, dogs and cats, and we believe that Australia, from the analysis that I did on some figures that I had, we're about 10% higher than what the US is. Increased rehoming rates and neuter programs have been a reality in the last probably decade and a half, 2 decades, whereas the US got started before us, and that's probably why we've seen, you know, a greater fall for many and several different reasons. And also the juvenile dissexing, you know, we only just started that in the 90s, whereas the US got ahead of us. Another picture of that. That's some tracking of the RSPCA. There's RSPCA national statistics, and I've got links in there. And it's worth having a look at those and seeing how things are tracking. And this was something that came out, I think this was 2008, this came out, that at that stage, over that last decade, the RSPCA had doubled the number of animals that have rehomed. Not sure exactly the influence that had on euthanasia, but you can work it out from the stats. And then this is actually a screenshot of the current RSPCA figures that are up there. And you can see that the actual, these are national figures from all, including from South Australia, and the actual number of animals euthanized for dogs in the last survey done, there'll be another one coming up soon, was 7,313, and that's down from 20,000 5 years before that. So there's been a significant drop in that period of time with RSPCA alone, and I believe it's reflective of the broader community because I've seen some evidence of reduction, certainly in New South Wales in pounds and shelters and at other organisations there. I looked at the South Australian statistics, and there's a similar fall for RSPCA, and similarly with cats too, there's been a substantive fall in that period of time. And before that, it was a slow decline, and there's been this more rapid decline in the last few years. Just mentioning there, we've already talked about them. These are really particular problem areas that need to be focused on. That was some work we did at AMREC, a special painting that sort of talked about people and animals working together. Time to finish. The critical things in getting unwanted companion animals down, being unwanted companion animals, euthanasias and pounds and shelters down, is to work hard on a lot of these different strategies. I would encourage you to go back and look at those 5 strategies, and there's more information and guidance from them about them in the information that I've provided to you. Be evidence-based, look more deeply into any possible solutions, and look for the ones that have worked, and certainly would encourage, wherever possible, to encourage you to encourage people to look at putting funding into research for this problem, that we can really get on top of it. And critically, I think, get more statistics in South Australia. Thank you.
Thank you, Mark. Now we've almost time for our tea and coffee. Before we go there though, questions for Mark, burning questions in your mind, things that you'd like to have explored. I think it's good that you're sitting near the front. We're going to get to know each other well. Here we go.
Hi, I used to work at Inner West Veterinary Hospital with Janet Cridland and Stephen Coulton and Petersham Veterinary Hospital. And I'm just interested to know if any of the pharmaceutical companies are funding more research these days. Are they putting much into it for this sort of thing?
Are you talking about like chemical spay neuter or? Yeah, you know, I spoke at a conference in Colorado in 2004. We did some work with a drug called Lawrie. We tried it on Aboriginal communities, on the dogs and cats there, and it was problematic in that it actually caused bitches to come in season and get pregnant if they were at a certain phase in their cycle. And, you know, we decided against going down that pathway. There was talk about another drug called ChemSpay. We had an AMREC conference in about 2003, and that was the latest, and was going to lead to permanent instability in dogs and cats out of University of North Arizona. Nothing's come of it. At the conference, it was called the AICD, I think it was called, and they put up, some donor put up $1 million for the person that came up with the solution to have a permanent, cheap, easily deliverable means of dissexing for dogs and cats, chemical based, and no one's claimed the prize yet. And huge amount of work done in reproductive management of kangaroos in Australia, and it's just, nature prevails and seems to be conquerors, and the cost of spay neutering, it's so subsidised. The price that vets charge for it in comparison, for an alternative operation, if you actually cost out what it really costs. I did some costings at RSPCA. It was like $150 back in 1992, and it should probably be about $500, $600, $700 now. Some places I think it is if you do lots of tweaking, but oftentimes it can be $100, $200, for spay neuters. It's highly cheap, and that's probably also something that challenges the chemical side of things. So I haven't heard of anything coming through the pipeline. Drug companies, they gave us a lot of support with those programs. We used to get free vaccines when we go out, particularly in the Indigenous community work with AMRIC, and they're usually fairly generous. But I don't think there's any rapid breakthroughs that are going to happen shortly.
Other questions? There was lots of content in Mark's presentation, which I think is really useful for you guys to have going forward. So I'm going to ask Mark if we can get a copy of your slides at all.
Yeah, that's okay.
Yeah.
They're a little bit messy because I touched them up on the plane. But most of the information is in one of the papers that I put there, was the paper that I delivered. It's just slightly dated and hasn't got those updated figures. So, But you can just go on and get the RSPCA statistics. They're really interesting to look at the trends, that happen. There was a rise in cat numbers when they put the new cat laws in New South Wales, which we think was because they didn't mandate that. I think there were some changes with the way they put the laws in place, and they didn't strongly enforce. The microchipping was in there, but they weakened it down so that councils didn't have to actually have holding facilities, because they would have had to hold the cats for 7 days if they were owned. And because of that, councils stopped doing management, and the numbers increased in New South Wales for cats in the late 90s, early 100s, and then they've declined again since then.
Excellent. So any other questions, or you can talk to Mark over, I think you're going to stay for afternoon tea? Yeah, that'd be great. Yeah.
So obviously you're a supporter of early age sexing. When I had a look on the submissions on the USASA website, I noticed there were a few people that have concerns in regards to early age sexing for dogs. What are your thoughts on that? Are their concerns valid?
Yeah, their concerns are valid. Again, it's this problem. The biggest problem we have in the veterinary world is there's lots of money to do research on cattle and sheep and even wildlife and horses. Not so much, but still some. And dogs and cats, there's no levy system. Governments don't seem to put a lot in. The SPCAs are putting a little bit more in these days, and some of the drug companies, but not a lot. And the research that's been done in early age desexing, there's been a bit, but longer term studies, there were some studies that said you shouldn't do dogs before 16 weeks. And so categorically, on the basis of the evidence, I'd still say there's some question marks over dogs. I think there's a moral counterbalance in controlling the numbers of unwanted animals if they're in RSPCAs and animal welfare leagues, who are unlikely to get sued. There was a case of suing in the US for an early age desexing issue. There are some potential downsides from the research in dogs, but I think the balance is to control this problem. Doing them in pounds and shelters where we've got control of those animals should be done. I think in the general population, there's often saying we should do them all at 8 weeks, and if you don't do them, people forget to do them. I don't think that's really true. I think generally if they bring an animal in for a vaccination into a vet clinic, a cat or a dog, the people are going to follow through, and usually the vet schedules them for the booster vaccination. And I think there's some wisdom in waiting and desexing them at sort of 4.5 months for cats, and maybe 5.5 months for dogs. They're a small animal. There's always just slightly greater risks in your management of that. You can compensate for that. We can do things in vet science these days. But if you've got a choice, slightly bigger, cats' kidneys are just a little bit more vibrant and stronger as they get older. That would be my advice and recommendation. But I'm strongly supportive of early age desexing in pounds and shelters, and as a means of contributing to reducing unwanted companion